This is Krista. Welcome back to MadeToBeWhole. Stay tuned for our discussion about rare causes of headaches that are often misdiagnosed and how to advocate for yourself as you review your labs and seek professional help.
MadeToBeWhole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on MadeToBeWhole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
This is Krista. So today we're going to be talking about the elephant in the room, I guess. As many of my patients know, I've been out for about a month with some medical complications, but every time through something, we learn things that can help other people. And so I wanted to share some of my journey, hoping that it can be instructive for you. It's not going to affect most of you, I think, as far as the specific diagnosis, but I also want to discuss the process by which we evaluated imaging and are seeking the right help, because we all as patients have a lot of barriers built into our healthcare system. We have this wonderful tool called the internet, but it can lead us astray too. So as those of you who have been listening know, I have been dealing with vector-borne infections and associated autoimmune encephalitis and have been making a lot of progress with those things. Particularly the associated anxiety had been really good, but over the last several months felt like I was also getting weaker and weaker. I didn't make it very long during the day. I'd go home at night and I'd have to lay down. Then it got to the point that even the afternoons were really difficult. And then a month ago, I pretty much collapsed. So a lot of the symptoms were associated with my head. So I did get an MRI of the brain, which is the start of this journey that we're going to discuss. And it's interesting, with the MRI, there was an abnormal result, but this is the warning to everyone. Our results don't always give us the full picture. For example, we frequently send patients to have imaging called a CTA, a CT angiogram of the abdomen and pelvis, and we say that we are screening for compression syndromes. If you want to learn more about those, our episode with Michelle dives into that because her son Carson had those. But compression syndromes are a very specific sort of vascular compression that can cause severe symptoms, be very, very disabling. Well, we learned that 9 times out of 10, when we sent an order, the report would just come back and say negative for compression syndromes. However, if instead of asking for that qualitative report, yes or no, compression syndrome, no compression syndrome, we asked for the actual measurements of the angles that we're looking at, that many of these people who we were sending actually did have findings that were very suspicious for compression syndromes, but the radiologist reading them is not an expert on compression syndromes and is using a different set of metrics. So we had missed diagnoses. Well, the same thing can happen with any sort of imaging, because every time you do an image, you have to tell the person what the qualifying diagnosis is, particularly if you have insurance, because the insurance company is only going to approve tests that have a specific diagnosis. So the diagnosis that was used for my MRI was encephalitis. That would be a qualifying diagnosis. So I had an MRI of the brain with and without contrast. There are a few little notations on there that can indicate inflammation, but there was something curious at the end that I was not familiar with, and it's something called partially empty sella. So the report says partially empty sella with pituitary gland volume loss. Correlate this with clinical findings and lab values. Now, something that all of us do in the medical field and as lay people is we turn to the internet to get quick answers on things we may not know a lot about. Now, if I do that and I do a little search, AI tells me that partially empty sella syndrome happens when spinal fluid fills part of the bony space at the base of the skull, flattening the pituitary gland. And then this, most people have no symptoms. Doctors often find it by accident on a brain scan. Treatment is only needed if hormone levels are low. So you can allow yourself to be dismissed. If you go down and you talk about the signs and symptoms, they say, hey, again, most people feel fine, zero health issues, but sometimes you can have mild, frequent headaches, low energy, rare vision changes, not a big deal. The recommended intervention is to just check your hormone labs. If they're normal, don't do anything. If you're overweight, lose weight, because that's the answer for everything. But super, super dismissive. So you could be led to think, well, they found this, but it's an incidental finding, and look, it doesn't really cause the sorts of things that I'm dealing with. But if you learn how to ask the right questions, you can get better answers. I was discussing this with a friend who had a friend who had a cerebral spinal fluid leak and said, oh, those are just absolutely brutal. It caused a lot of problems and it took her a long time of specialists to get the right help. And so if you refine your search and you say, okay, what about if I search for partially empty sella syndrome and a cerebral spinal fluid leak? I'm going to do a much more specific search. And then we find out that a partially empty sella and cerebral spinal fluid leaks are often connected through chronically elevated intracranial pressure. That means pressure inside of the skull. So anything that can cause increased intracranial pressure weakens the dura mater and erodes the bone and membranes at the base of your skull. And the thinning of those areas can lead to a spontaneous cerebral spinal fluid leak. That's when the fluid leaks into other areas, can be from your nose, from your ear. They're most common in middle-aged overweight women like me, the same group frequently seen with empty sella findings. Now, if I just stuck with AI, I could look, and the first thing they say is, well, you might need to lose some weight, you might need to take this medication. But I've had persistent, evolving, disabling symptoms, and I really think something much bigger is going on. One of the resources that I would really encourage people to go to when you're looking at some of these conditions, find something that is either patient driven or patient funded or a foundation, and a lot of times those are synonymous. So there is a spinal CSF leak foundation, and their little tagline is because your dura matters, which is really funny because it's your dura mater that gets eroded and causes the leak. So a little geek humor, but there was a lot of really, really good information there that was very validating, but also helped a lot with finding the right treatment. So you have cerebral spinal fluid leaks that can happen spontaneously, or they can be caused by a medical procedure like a spinal tap or an epidural. The ones that are caused by a medical procedure are usually caught because you have a cause and effect that happen pretty spontaneously. I actually met a woman when I was at the hospital who had a lumbar puncture that caused a leak, and she was in agonizing pain. She had the procedure to fix it. It didn't work, but because it was something acute, her body was able to heal itself in 2 to 3 weeks. With these chronic long-term leaks, you don't have that same luck. And what causes the symptoms is what's called intracranial hypotension. So you have two competing things that are causing similar symptoms with really distinct causes. So you have the intracranial pressure that's increased, okay? So high pressure, but when that happens, you get this leak that causes intracranial hypotension, which means low blood pressure. And that is what makes being upright so difficult and so agonizing, because when you're upright, basically your brain gets dehydrated. That fluid that should bathe your nervous system, carries the nutrients there, keeps everything lubricated and working, doesn't stay in the right space. And so you can get dizzy, you can get nauseous, you can get a wicked headache, your vision is impaired, you can have ringing in your ears. There's all sorts of things that are associated with being upright. Now, when I think of my patients and other people who have positional headaches, I think of other people that maybe we need to be screening for something bigger to see. It could be that it is a typical migraine. Absolutely. It could be POTS related. It could be a CSF leak, or it could be all of those things. And that's where you get so much complexity in the world of zebras. I've shared before the analogy that many people learn the first day or week of professional school, whether it's graduate school to be a nurse practitioner or medical school, they teach you if you hear hooves, think horses. The most common things happen the most commonly, which is true. You know, the first thing, if somebody comes in with sinus pressure, you don't want to say, oh my gosh, I think you have cancer. Obviously, you want to first say, well, let's do a history. Let's do a physical. This looks like sinusitis. We treat it. But if you're doing the usual treatments and not getting the usual responses, the answer shouldn't be to blame the patient. It is to say, okay, well, what else could mimic these symptoms? Are there other contributing things that are going on? So I want to go through some really interesting things. I do give a shout out to this website. It's the spinal CSFleak.org. So spinal CSF as in cerebral spinal fluid leak.org. So they give, I think, some very patient friendly explanations of the symptoms. We talked about the headache, the nausea and vomiting, hearing changes. I've definitely had muffled hearing, especially on the left, with constant high-pitched tinnitus in the left, neck pain or stiffness. So people talk a lot about that in the world of Lyme and vector-borne infections. They talk about this coat hanger pain, but that could also be a symptom of a CSF leak. So could photo or phonophobia, which is that sensitivity to light and noise. So could that telltale pain between the shoulder blades that many of us have. Pain or numbness in their arms. If I stand up for very long, recently I have a lot of tingling in my hands. Brain fog, those cognitive changes, those can all go with it. Visual changes. And I find this interesting from a personal note because most of my vision issues happen when I'm upright for very long. Things start going in and out. It's been kind of recently worsening. Facial numbness or pain. I've had a lot of tingling around my mouth. You can get changes in taste, pain or numbness in other areas, fatigue, obviously, and you can even get something called galactorrhea, which is fluid discharge from the nipples. I don't know if that's specifically related to the leak or if it's related, like in my case, if I were to have that, anybody who has a compressed pituitary, your pituitary hormones are going to be affected, including prolactin, that could do it. There are rare, more serious complications that we're not really going to talk about because I don't want to freak people out, and they are rare. But this is obviously a very disabling, potentially disabling condition. One of the points that they make is that many people don't know they have it. It's underdiagnosed because a lot of medical professionals are not trained to recognize the sign. And most people do well with treatment. So there's something called epidural blood patching when they use your own blood to patch that area to stop the leak. They have to do a very specific type of imaging to locate the leak. The key, I believe, for this is finding the right person to do it. So in their little website, they say surgical repair of spinal CSF leaks have good success rates in the hands of experienced neurosurgeon. I think that's really, really critical. You need someone who does this all day, every day. You don't need someone who learned about it in school or did it in an emergency room. If you have a chronic condition, you really need to do the homework and travel to find someone who is doing this all the time. They mention neurosurgeons, but there's also a branch of medicine called interventional radiology. So that means radiologists who use imaging to find things and then do things with that imaging and during that imaging. I hope that's a good enough explanation, but they are very, very skilled, and it's a super special subspecialty. Now, one of the other little internet traps that you can fall into is if I go where I'm living and I talk about CSF leak, experts near me, everything I type in this area, there is an algorithm that is going to feed me the name of specific big medical centers near where I live, because the algorithm is built to feed them as the expert on everything. And they do a lot of things really well, but nobody is the best at everything. And if there is someone who is, I haven't met them yet. So what I did was I dug a little deeper and I looked at patient forums. I found other people who had experienced this and what they were saying about where to go to get treatment. And the places that AI fed me as the best didn't get good reviews from patients. One person said, yes, I went to those places for 2.5 years. They didn't know anything about CSF leaks. I finally had luck when I decided to travel elsewhere. So when you are looking for help and for resources, look to foundations that are built by patients and families, and look to patient experiences. Now, there is a line with that, because I follow some of these forums for vector-borne infections and other things that are patient-driven. And you as a patient are in a really, really tricky spot, because you've had to be your own advocate. You've had to be your own healthcare provider because you have been dismissed by people who should have helped you. You've been misdiagnosed by some people, and you're in a rough spot. But you have to be super, super careful not to extrapolate and to assume and promote that what is true and worked for you is the answer for everyone, because everyone is complex. Everyone is unique. Everybody has genetic, environmental, emotional differences, and you just can't put everyone in the exact same box. I want to read you a post that I found that actually referenced an article from 1949, and I thought it was absolutely fantastic. This is an article that was published in the Lancet on the 27th of August, 1949, by Dr. Richard Asher, who was a physician at Central Middlesex Hospital. So he said, decades and decades ago, that there were 7 medical sins. And I think they remain super, super relevant today. So, number 1, obscurity, using complicated and convoluted language. If you can't explain it simply, perhaps you don't understand it either. Number 2, cruelty, performing unnecessary procedures. We see that, but I also see a lot of cruelty in the way patients are portrayed and dismissed. Bad manners, lack of basic courtesy, over specialization. And I think this is the big problem for a lot of my zebras out there. You have a lot of super specialized things going on, and it's so hard to get providers to talk to each other and collaborate. And so when we over specialize, we run the risk of focusing on a single organ while forgetting the entire patient. But that could even happen with the brain. I did it a little bit to myself. I kept saying encephalitis, encephalitis, encephalitis. My symptoms are related to it. And a lot of them were. And it may have been the domino that started all this, but other things evolved from there. And I was looking too much at the trees and needed to back up and look at the forest. Love for the rare, obsessing over rare cases. I don't see that quite as much. And then he says, number 6, common stupidity, which I think is a problem. Thinking in protocols, algorithms, etc., lacking one's own judgment or clinical reasoning. And then number 7, laziness, not making an effort, not reviewing data, not delving deeper. So I think those 7 sins of medicine still apply in our medical community today, but also look in the mirror and see if you are doing any of this to yourself or to people you care about. Are you being unkind to yourself? Are you overcomplicating things and then getting upset when people don't understand? Are you focusing so much on one aspect of your symptoms that you're missing the bigger picture? We need touch points. We need other people to talk to, and we need kindness. And remember that a lot of people who are the most ill and struggling the most may look okay. That's one of the real challenges with a lot of chronic illness. People walk and talk okay, they hold themselves together in public at work, but you don't know what they're doing when they go home at night. I know one of my kiddos has mentioned to me through this that it's been a little difficult, and I completely understand now that I had this major disabling crash and I'm physically unable to work and be upright in the capacity that I'd like to short term. People are paying attention to me and acknowledging how sick I am, but this kid's really sick too, and nobody gets it because he's funny, he's outgoing, he's kind. People see that side of it and they just don't understand. And it's hard. It's really hard when you don't see the day to day, but be kind. There are a few people out there who like being sick and like being the attention. Most people don't. Most people want to be up and functioning and productive and living their best life and doing age appropriate things. And so if you don't understand, be grateful that you don't understand. Ask good questions. Ask to listen and understand, not to accuse, and ask lots of people, because it's through multiple streams of input that I feel like you'll get the best answers. I've been able to put this puzzle together through the comments of friends, talking to other professionals, internet searches, imaging, education I've done in the past. There have been so many different things that have contributed to me finding answers for my health and healing. No one person or organization holds all truth. So be open. Be open and don't be afraid to question things. If that sounds too good to be true, it probably is. Learn to trust your gut, but be patient and be kind. I want to express extreme gratitude for the people who have been very, very kind through this. I know there are bumps at the office. The people who are still there are working tirelessly. I'm so grateful for them, and I ask you to be kind and patient to them. This certainly wasn't anything we planned, expected, or asked for, but we are here to help you heal, help you be whole, and we ask you to stick with us so that we can keep finding answers to help you on your healing journey. Remember to have hope, because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.